vertical under Pune Knowledge Cluster. Today we all have gathered here for a second talk under our health series. The talk details are importance of epidemiology from a public health perspective. So healthcare is vital to all of us at all the time, but public health is more important to all of us than only healthcare. Today, Dr. Prakash Doke will give his insights to us to understand the importance of epidemiology from a public health perspective and how it helps in development of policies for public health. Before commencing the talk, I would like to introduce Pune Knowledge Cluster in briefly to all of you.
Yeah, your presentation is visible, Punima.
Yes, I'm just doing full screen. Yes. So Pune Knowledge Cluster is being established by Principal Scientific Advisory to Government of India. It was established in 2020 under the City Knowledge and Innovation Cluster Initiative. There are 6 such clusters in India, but Pune Knowledge Cluster is one which is hosted by Inter-University Center for Astronomy and Astrophysics in Pune. The vision of Pune Knowledge Cluster is to bring all the academics, research and development institutions, industries to understand the problems and address problems of the city by using scientific knowledge and skilled resources. Our mission is to act as a catalyst to bring this talent pool together and work together on projects of importance and value to the Pune region. The role of PKC is citizen engagement. We do technology and innovation adaptation, multi-organizational science and technology-based projects, and value to the region, which is planning and strategy for decision makers to understand what we can do. We have different stakeholders and partners, which are governmental as well as non-governmental organizations. We have research organizations, NGOs, R&D labs, and international organizations with whom we partner to bring up this change. Under Pune Knowledge Cluster, we have 5 different verticals. One is sustainability and environment, sustainable mobility, health, big data and AI, and capacity building.
Hello.
Under each vertical for health, we build collaborations across academics, industries, non-government and government departments to generate data which is critical for public health and to make decisions for the city. For sustainable mobility, we are applying scientific and technical tools to address the rapidly growing and changing mobility requirements of the city. The third vertical is Citizen Science Program, which comes under Big Data and AI, where we are building a platform that will encourage the citizens to participate in big data analysis. A fourth vertical is Sustainability and Environment, where we focus on water, food, livelihood through carbon sinks and promoting green energy utilization. A fifth vertical is Capacity Building, in which we collaborate with the institutes, academics across Pune to new opportunities and improve the knowledge base for students, researchers through interdisciplinary training programs. For these 5 verticals, we have our team, and this is our leadership members. Professor Ajit Kembhavi, who is Principal Investigator, Professor Emeritus, Ayuka, Ex-Director Ayuka. Professor L.S. Shashidhara, he is a Co-Principal Investigator. He is Dean of Research, Professor Biology, Ashoka University, Professor Biology, IISA Pune. Professor Soumik Rai Chaudhary, Director Ayuka, PKC Implementing Organization. Dr. Raghunath Mashirkar, Chairman, PKC Advisory Committee. Ms. Rashmi Rudvarshe, who is Senior Advisor for PKC, and she was President SAE India and ex-Director ARAI. Ms. Anita Kane, who is Senior Advisor PKC, CDO PMC, ex-TCS employee. And Dr. Priya Nagraj, who is a Chief Operating Officer for Pune Knowledge Cluster. She has a PhD in Biology from University of Virginia. Before commencing the talk, I would like Priya to introduce Dr. Prakash Doke further. Over to you, Priya.
Thank you. Good evening, everyone. I'm Dr. Priya Nagraj. Thank you all for being here today. We're very privileged to have Dr. Prakash Doke with us. Thank you, Dr. Doke, for taking the time to do this webinar. Dr. Doke is a professor at the Department of Community Medicine at Bharati Vidyapeeth Medical College. He's the former Director of Health Services, Government of Maharashtra, and also the former Executive Director of the State Health System Resource Center in Maharashtra. Dr. Doke has published over 65 research articles in national and international journals, and today he will be talking to us about the importance of epidemiology from a public health perspective. Over to you, Dr. Doke.
Today we'll be discussing maybe about 40 to 45 minutes about the epidemiology and public health and importance of epidemiology in public health. So to start with, let us in a brief try to understand the concept of epidemiology and public health. Young friends, the role and importance of epidemiology has tremendously increased during the pandemic of COVID. So we realize how this is important to know epidemiological factors in spread of the disease and control of the disease. So today's probably discussion has a context of COVID pandemic. So we have to remember it. There are some principles in epidemiology. We call as the axioms of epidemiology. The first axiom of epidemiology is it's basically and foremost science to use to improve public health. And whatever the tools we use, the scientific and public health in question, and these methods are means to achieve the improvement in public health. And third is, this is basically a general principle. The occurrence, distribution, and determinants and control of health states are important cornerstones of the studies. So it is in the reverse way. First, you have to study, use various methods, and then lastly, achieve the improvement in public health. Whereas what is the basic concept of public health? One of the best definition which we know in public health is given by Wien's law. That says it is the science and art. Young friends, I'm sure you know the difference between what is the science and art. So public health is both science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organization, public and private communities. World Health Organization defines public health. It aims to provide maximum benefit for the largest number of population. So when we speak of public health, one has to remember it is very distinct from clinical care. I will try to share the differences between these two. What is the public health and what is clinical care? In public health, as we all know, the focus is population. In clinical care, the focus is individual patient who comes to you. In public health ethics, here is the personal ethics. Emphasis is on prevention or public health. In clinical care, the emphasis on diagnosis and treatment. Here, joint laboratory and field involvement. In the clinical care, there is no field involvement. It is a laboratory plus patient. In public health, clinical science is peripheral to professional training. In clinical care, clinical science is essential to professional training. And public health is mostly served through public sector, government sector, and clinical care mostly through private sector. This slide gives the public health approach, how the public health department at Government of India or Government of Maharashtra functions are supposed to function. So it is a problem solving approach. The first important, what is the problem? This will come to know by gathering the data, what we call as the surveillance. And this should be a continuous process. The officers at helm should be aware what are the problems in the community he or she is supposed to cater. Then when you realize the extent of the problem, we must analyze what are the determinants for that particular problem or to that extent of the problem. Even it is low, why it is so low? If it is so high, why it is so high? In technical term, we can say it risk factor identification. After identification of risk factors, you must have some interventions to obligate the problem or to reduce the problem. There may be many strategies or policies to reduce it. Out of these many policies, strategies, what works the best? And then after analyzing what works the best, maybe on pilot, maybe on paperwork, implement it. How do I do it? After implementation, see the response. Is it really happening or not? So this is the basic public health approach for any problem. After this approach, for doing activities in this fashion, there are three core public health functions. And these functions are, maybe there is some duplication between the strategy and the functions, but one must understand the functions. The first function is what is equivalent to surveillance, systematically collect, analyze, and make available information on health of the communities. The most important function of public health is policy development. So it is not an individual. If you remember the earlier slide, what is public health? It is not individual to address the problem. It is basically the community, the government, the lawyer, the health force workers, everybody, even the statistician. They, rather than doing individually, collectively give evidence and a policy is developed. Promote the use of scientific knowledge in policy and decision making. And what is this purpose of doing all this? Ensure provision of services to those who are in need. So these are the three functions of the problem. Policy development to redress the problem. By developing the policy, you assure that the services are provided to those who need it. We have seen the approach, we have seen the functions, and now we have seen the actual services. What is assured? The last in the earlier slide was assurance of services. So what is assured? The first is monitoring of health, diagnose and investigate, inform, educate and empower, mobilize community partnership. Again, we have to remember that providing services cannot be achieved unless the community is involved. develop policies, and for developing many policies, you have to enact acts and enforce the acts, provide care, assurance of competent workforce, evaluate and research. So these are the essential public health services. All of us, we know that, and we discussed earlier also, in public health, who are the stakeholders? The graph gives that 85% of stakeholder is government. Then about 8% international organizations, 5% non-government organizations, and only 2% is the role of private practitioners. So in short, public health is mostly government driven. Containing the same slides, who are the partners in that? The first is they must have strong community commitment by politicians, bureaucrats, medical and paramedical persons. Unless there is a strong commitment from all these three, politician, bureaucrats and medical, a good public health may not function. And as a personal, medical and paramedical who are involved in that, doctors and paramedicals, and again, friend, lawyers. Maybe we'll see if time permits what was the role of the lawyers. Even today, we are aware about many acts, directly health related acts. Social scientist, statistician, we'll discuss more about role of statistician, entomologist, biologist, and non-medical persons. There is no need to emphasize the role of policy function in public health. World Health Organization defines policy as decisions, plans, and actions that are undertaken to achieve specific healthcare goals within the society. And these policies should be always evidence-based. We'll examine some examples how the public health has been benefited by evidence and making policy. So how this evidence is created or generated? Assessment of the health needs of population. Again, there may be repetition, systemic collection, analysis, and distribution of morbidity, mortality, and disability. You will get this information. Assurance that services to promote and protect the health of the public are provided directly or through the others, and development of policy for protection of health grounded in scientific knowledge that serve the public interest. So as I said, we'll be considering few examples how the policies are generated. Public health policies are generated mainly by three aspects or three reasons. The first important reason for change in policy or making policy is an experience. Let us take example, suppose the Honorable CM gets something, he believes, he gets knowledge that something is so important and he himself or herself gets benefited, then there may be a change in policy. That is the experience. Second, when there is always change in government, the policy change. The third, a very learned and strong bureaucrat or administrator. These are the policy drivers. Here we are sharing one of the policy driver. This is the data evidence. The slide shows that if we collect data, analyze data globally, the causes of mortality are given below. This is the standard epidemiological information, what we call the common causes of death. 10 common causes of death. This is a very important tool in global tool. So what the global tool tells that ischemic heart disease is the leading cause of death. And not only leading cause of death, but it is increasing. In 2000, it was 6.8%, 6.8 million. It has now increased to 8.9 million. Stroke, cerebrovascular stroke, increased from 5.5 million to 6.2 million. Chronic pulmonary disease increased from 3 million to 3.2 million. And there are declines also. Lower respiratory tract infection declined from 3.1 million to 2.6 million. Neonatal conditions declined from 3.2 million to 2 million. Trachea, bronchus, lung cancer increased from 1.2 to 1.8. Alzheimer's disease and other reasons of dementias increased from 0.6 to 1.6. And fortunately, in developing countries, the diarrheal diseases death have reduced from 2.6 to 1.5%. Friends, why we are discussing these causes? The causes are discussed because the public health actions are dependent. Global public health actions are dependent upon this knowledge of causes of mortality. And first important objective will be reduce deaths, and the second objective will be better improve the health. So when we see this non-communicable disease, the first few causes were non-communicable diseases. Ischemic heart disease, stroke, chronic pulmonary disease, they were all non-communicable diseases. And as a group, what are the policies and that are useful to improve the public health, to reduce the mortality and morbidity? The first is tobacco statutory warning, ban on sale, ban on media. I am sure you are aware how the pictures are printed on cigarette packages. Tobacco is not permitted to be sold in educational campuses or nearby educational campuses. There is a strong reason that this is associated with malignancy and coronary heart disease. So this public health action of law enforcement is based upon the data. Alcohol ban on advertisements. Although the manufacturer finds some loopholes, they say that this is the bagpiper is the mineral water, and they indirectly know that we are promoting their liquors. Anyhow, I don't want to comment on that. Air pollution and production of vehicles. I'm sure you must be aware that Supreme High Court has banned all vehicles which are more than 15 years old from capital of India, from Delhi. Not only that, it has been made mandatory to have Bharat 5-6 complying vehicles. Safety belts, helmet use, these are all rules and regulations and acts to support public health actions. Food policies and knowledge about genetically engineered crops. So I have given example how the epidemiology has resulted into public health action, particularly through acts and rules. Here has given a very specific example, and I'm sure you will like to have information about this. Presently, when a person having chronic cough attends any OPD, 2 sputum smears are collected. I am just expressing the reason, genesis of this change. A systematic review of 37 eligible studies that quantified the incremental diagnostic yield of serial sputum specimen was performed recently. The results clearly demonstrated that the vast majority of TB cases, on an average 85.8%, was detected within the first sputum specimen. With second sputum specimen, the average incremental yield was 11.9%, while the incremental yield of third specimen when the first two specimens were negative was only 3.1%. So Government of India has taken a decision then collecting and examining the third sputum sample is not yielding or it is not cost effective. So we have strongly recommending only 2 specimens. Let us take one more example. We are just giving experiences how this epidemiological knowledge has resulted into public health actions. When you see the slide, this malaria parameter in this decade, new millennium, these are the technical words: annual parasite incidence, slide positivity rate, slide falciparum rate, and annual blood examination rate. Without going to the details, you will see that all these line diagrams are declining and declining. And the implication is straightforward: malaria is declining. These are the technical indicators of malaria. Let us go to administrative indicators or action indicators of malaria. Malaria, number of cases, out of that how many falciparum cases, and number of deaths. See friend, the number of deaths has decreased from 1,707 to 93 in 2020. Any sane person, after reviewing the statistics, will certainly say that we have a very well functioning program for control of malaria. And therefore, across the globe, including India, we are targeting that malaria should be eliminated by 2025. What are in general uses of epidemiology? Epidemiology is responsible for generating knowledge, information, and technology that can be used in the development of policies for the promotion, prevention, and control of health problems, and also evaluation of policies. So these are again after uses, how it's specifically used. Some examples we have examined. There are few more examples how the pathway for epidemiological evidence to public health policy. These are the regulatory mechanisms. I'm sure you must be knowing what is called as Factories Act. Factories Act is one of the best example how the health of industrial worker is protected in the act. Is one of the very beautiful piece of legislation. If you are interested, you please go and read the Factories Act. The occupational health and safety. There are various parameters they have given in this. Environmental quality. You must be aware again, in Germany, all the heads of nations are meeting and discussing the environment quality. Drug safety. What are the public health, especially public health recommendations? Vaccination for all vaccine preventable diseases. Diet. Again, we may refer to the causes of death. First 10 causes of death, commonest, the first was ischemic heart disease and cerebrovascular stroke. All epidemiological studies very clearly point out what are the risk factors. You know the process also, from surveillance to determinants of risk factors, taking action. So what are the risk factors for the very high mortality due to ischemic heart disease is the lifestyle. The lifestyle change is responsible for ischemic heart disease, diabetes, hypertension. And here the two specific are included, the diet and smoking. My students from medical colleges, we just carried out one small survey asking the medical students when they did have last square meal. I'm sure you know what is square meal. Square meal is ingredients, food grains, rice, chapati, two vegetables, curd, milk or milk products, veg, non-veg and fruits. This all together is called as square meal. The question was, when do they have last square meal? And the answer was before 17 days. So what they eat? They eat pizza, they eat noodles, they eat burger mostly, and sometimes vada pav, sometimes pav bhaji. So imagine friends, if this is the lifestyle, can we really reduce the deaths due to ischemic heart diseases? Fortunately, smoking is decreasing, but gutka and tobacco consumption is increasing with very exponential speed. You go to colleges, go to any workplace, you will find many people using gutka or something like that. The other pathway is legal system for causation of injury. I have told you, like helmet, speed belt, and healthcare delivery, practice guidelines, outcome assessment, National Medical Council, Maharashtra Medical Council frequently give guidelines. Some possible translation of epidemiologic evidence into policy. This is again a theoretical one, how this can be used. Application of causal criteria. If it is not available, expert opinion. In COVID pandemic, you must have seen that there were so many experts opining what is this and we'll be getting third wave, fourth wave, etc. Consensus methods, committee reviews, quantitative synthesis, risk assessment, and jury evaluation. When the data is not available and a public health administrator wants to take some public health action. This is complementary to epidemiological evidence. Am I clear? These are all complementary. Again, pardon me, I'll just tell about few important aspects of epidemiology because I feel that it is very pertinent. You must know about this. We must be very proud to say that first information about epidemiology is probably given in Ayurveda. The word is called as Janapadvamsa, means mass devastation or pandemic, large epidemic or pandemic. And it says that the causes for this Janapadvams are water, air, and places. And the next says that Hippocrates, before 400 BC, who is considered as father of modern medicine, exactly in same words, has published his finding on airs, waters, and places. He hypothesized that disease might be associated with physical environment, including seasonal variation in the illness, very similar to Ayurveda. I will not go into all the detail, but I cannot resist myself explaining or at least mentioning these two scientists, John Grant and John Snow. The epidemiology starts with statistics. And John Grant in 1662, there is a policy, there is a regular rule that weekly in UK, there is bills of mortality, why people are dying. It's a very routine mechanism in UK. So he analyzed bills of mortality and produced his finding, presented his finding in natural and political observations made upon the bills of mortality. That was the first statistical method describing population vital statistics. He hypothesized that poor and socioeconomically lower status people are dying more frequently than elite. And I think what was said in 1662, still it is true and will remain true for centuries. Coming to the next scientist, as I said, I can't resist mentioning his name, John Snow. He formulated natural epidemiological experiment to test the hypothesis that cholera was transmitted by contaminated water. And again, friends, at that time, there was not even concept of cholera bacteria, right? So after the history, how the science of epidemiology helps public health. It starts with how the problem or extent is, how the problem is distributed, and what are the determinants. The determinants means risk factors and causality. And when we know these determinants, naturally we have to take actions against these determinants. So in short, it is the study of occurrence and distribution of health-related events, states and processes in the specified populations, including the study of the determinants influencing such processes and the application of this knowledge to control relevant problems. I will not go into again these details, what the study means, distribution means, and determinants means. Here, only important point to remember is that it is not only the disease or the mortality. Even it may be applied for disability, it may be applied for any specific problem. Okay, again, the importance of epidemiology in public health or importance of gaining any knowledge about determinants or distribution, it has to answer some questions and then it becomes the evidence. I'm sure you know the poet Rudyard Kipling, who is famous for his Jungle Book. Many of you must have seen this Jungle Book when you were young children. His famous poem, what is the poem? I keep 6 honest serving men. I keep 6 honest serving men. They taught me all I knew. And their names are what and why and when, and how and where and who. So one has to collect information about any public health problem. What is the problem? Why the problem is there? What is the extent? Why the extent? From where it is appearing? From when it is appearing? How it is appearing? How means again the reasons, the places where the problem is, and lastly, who are the sufferers. So any public health person must get information about these all aspects of the problem. This extent of the problem can be explained in 3 levels. The first level is called as endemic level, where we public health specialists usually do not pay attention. The reason itself is that few cases occur infrequently throughout the year. Endemic means few cases occur throughout the year in scattered fashion. But when I say a public health specialist usually doesn't pay attention to endemic diseases, but the endemicity level may be low, moderate, or high endemicity. When there is high endemicity, you just cannot ignore it. The second level is epidemic. I will not explain the epidemic word, but let us see the pandemic word. The pandemic word has become so popular after COVID that everybody knows what is pandemic. But basically, the disease which occurs in more than 2 countries and more than 2 continents is called as pandemic. And again, young friends, it's very sorry to say that there were 6 pandemics of cholera, and almost all pandemic originated from India, and that too from Ganges, the delta region of Ganges, Calcutta and nearby Calcutta. So it's very unfortunate and would never feel pride about it. Cholera pandemic starting from India. Again, it may be out of place here, but I cannot resist again to see what is more important. Is the deaths are more important or the disease is more important? The technical words are called as morbidity and mortality. So what is the difference? The first is death occurs only once, and that is unequivocal. There is no ambiguity. There is no second opinion. The person is died or not died. So it occurs only once. It's a very certain event, and there is no ambiguity. And usually reliable data are available about the deaths. And again, friends, awareness about death is there. We have a local language say that people ask only, बुढ़ी मर गई है क्या जिंदा है? So only people are aware about death. Nobody asks about the health or उसको कुछ हुआ है क्या? So illness. First is awareness about death. The second is illness and how she is, how healthy she is. Nobody bothers. Health is never bothered. On the counterpart, morbidity, diagnostic difficulties. There may be various levels of biochemical level that also depends upon subjective feeling. A person is exposed to diseases many times. Not only many times, he or she may suffer from more than one diseases. Data are usually not available. Then in the counting, what should be counted? Episodes should be counted or individuals be counted, and time frame. These are all important differences between mortality and morbidity. These are important to give priority. How epidemiology helps in deciding the priorities. The criteria for deciding priorities are usually, the first is what is the magnitude of the problem. Magnitude includes both morbidity and mortality. The second importance is what is at stake. Is it death? Is it permanent disability? Or is only a mild fever or uneasiness for a day or two? to answer these questions, what is more important? I think it's just common sense. The large magnitude and what is at stake, death or disability, will be always the priority. The other priority is then, is anything available to address the problem? Otherwise, we make the person unhappy by detecting some disease in that and without giving any treatment. Another reason to, another criteria for deciding priority is the trend, the time frame. Is it increasing or it is decreasing? Anything which is decreasing doesn't need attention. But friends, there is again exception. A disease which is declining, there is declining trend, and which is close on the verge of elimination or eradication is given utmost priority. So priority is bifocal, one for high magnitude and one for low magnitude, where in the recent future elimination or eradication is possible. So this type of data you must have for deciding public health priority. This I will not go into this. These are mostly technical for calculating the magnitude. Okay, coming to the components of modern epidemiology. Acute disease investigations, emphasis on empirical system investigation, biology and environmental host manipulation, medicine. All early epidemiologists were physicians, but nowadays many non-doctors are also contributing to epidemiology. Statistics. Friends, remember, whenever there is a large data, the role of statistics cannot be overemphasized. Social sciences, human behavior, as I was telling you, this is the most important reason of the pattern of diseases. Large data and computer sciences. Managerial sciences, because again, this is a large data, policies and administration. And genomics. Nowadays, genetic epidemiology is an emerging branch. Many diseases have its origin in genetic makeup. So those who are interested in this career, it's a really important career in future. And epidemiology principle is that magnitude and cause and effect relationship. You have to prove that these are the determinants, these factors. And these are the new approaches for deciding cause and effect studies. Causal inference framework. The counterfactuals. I'm sure you know what is counterfactual. A thing is happening, then you counter say that if this could not have been done, what would it be the situation? Suppose now there is an accident, the motorcyclist was not wearing helmet. So what is the counterfactual? If suppose his speed would have been less than 40, if suppose he was wearing helmet, something like that, and you calculate the priorities, counterfactual. Then there are directed acyclic graphs, graphical methods, what happens, when happens, propensity scores, then G method, generalized method, artificial intelligence. I think when Purnima was explaining about the Pune Knowledge Center, artificial intelligence is a very important and challenging thing which helps in epidemiology and public health, including deep machine learning. These again, last one or two slides. In public health and in determinants, particularly in developing countries, the role of sanitation again is extremely important. And this has been repeatedly shown from 18th century by these two persons, Edwin Chadwick, and Lemuel Shattuck. And the one thing is sanitation for public health problem, and the second is social determinants. Again, like earlier, there were two scientists. For social determinants also, there are two scientists, Sir Douglas Black and Thomas McEwan. These are the two famous persons. I really request you to go and read what is the Black report and McEwan thesis. They clearly show that all this morbidity and mortality does exist in lower socioeconomic class. So at the end, the public health problem, strong determinants in developing countries, it's sanitation, and other strong determinant is the socioeconomic status. And this is the contribution of epidemiology for public health. To summarize, patient-doctor relationship for individual problems, thinking at large, increasing canvas is epidemiology. For problems in the community, contexts differ. The sequences measure the problem, determine the causes, analyze it, and suggest probable solution. Epidemiology is the rational way of thinking for any problem. So, thank you, friends. We can do miracles if we combine all these young friends and administrators. I am sure we'll be very healthy community. Thank you. If you have any queries, any questions, most welcome. Purnima, is it okay?
Yes, sir, it is okay.
Yeah. Anybody, any comments? I will be very happy to have interaction.
Yes, any questions?
No comments. Forget about questions. Your comment,
There is
your
a
reaction.
question. What are your thoughts about the COVID fourth wave?
See, that it is a virus, and virus, there are always mutations in any virus. So this virus will also have many mutations. But one thing is certain, that with mostly the mutations, the virulence decreases. What I am saying, that mostly with the mutations, repeated mutations, the virulence decreases, and we are also observing the same thing. The second important reason is that there is a virus, although mutated, it continues to have its genes and antigens, may be modified, may be partially modified. Therefore, among fully vaccinated, either the fully vaccinated person will not get the disease, even if or she gets the disease, it will be certainly mild disease. Therefore, even though the number may increase slightly, it will not be to the extent of second or third wave. Even if it increases, it will be slight, there will be increase, but slight increase. But one thing is certain, that there will be less case fatality rate.
Okay. So one more question. How
Yes.
artificial intelligence will help epidemiology in public health sector?
Okay. I think after this interaction, I was thinking to contact Purnima for artificial intelligence and deep learning. I will give one example, madam.
Okay.
Presently, the malaria is diagnosed by examining the peripheral smear in a slide, on a slide, right?
Yes.
And for that, a very highly skilled laboratory technician is required. Many times, highly skilled laboratory technician is not available. First thing. Secondly, there is a shortage of persons. And thirdly, our present system is that from a village, the slide is transported to primary health center where the laboratory technician sees it and diagnoses. It takes time. So as an artificial intelligence, what we are suggesting that you collect thousands of smears, positive, negative, feed it to some maybe scan procedure, something like that. And by thousands of scanning, we can come to the conclusions that if this shape, this coloration means positivity and that to smear. If you know that, and if you give this on a maybe tab or mobile, just insert the slide into the socket provided on tab, and at village level, you can diagnose and treat the patient. Did you get my point?
Yes, sir. Yes, I
And,
got your point.
well, yeah,
One
we
more
are
question.
trying- Yeah.
Any examples on predictive surveillance that you could share with us?
Yes, maybe predictive surveillance. We started in dengue. What we were doing that, where our health worker were visiting house to house, and then he was calculating various indices required for mosquito density. And we really aborted few outbreaks only by saying that the mosquito density is increasing, and we could thought the outbreak of dengue. It has happened in many times. So this is a signal, predictive signal.
Predictive signal.
Secondly, again, malaria also. If it is rains heavily, if it runs heavily, everything is washed off. There won't be any malaria because the larvae mosquito are washed off. But suppose the rain intermittently after 10 days, 12 days, 14 days, there is water collection and there is no rain. Again, after 10, 12 days, there is rain. It's a very beautiful condition for breeding of mosquitoes. And malaria will increase. If there is intermittent and low, heavy, not heavy raining, low raining, this is the predictive value, predictive indicator of increasing malaria. Do you agree with me?
Yes, sir. Yes, we do an surveillance type like before.
It's surveillance, but not disease surveillance. It's before the disease.
But it's this predictive.
But before the disease, yes.
Okay. Other question is why is that more doctors don't directly take part in promoting public health?
It is not paying, madam. I am from public health. What we describe is unwanted prescription. Yes. Nobody wants to listen to change in lifestyle, listen to live something, have good food, good diet, breathe, exercise, etc. These are our prescriptions. They are not liked. Secondly, the public is unaware about the importance. Suppose I give my personal example. In Maharashtra, the case fatality rate due to acute diarrheal diseases was about 2 to 3% in 1994. 2 to 3% children were dying due to acute diarrhea. This is very high considered to international standards. So what we have done, what is required for a dehydrated child? This is required as an isotonic solution, or what we we call it as a ringer lactate, right?
Yes.
Rather than giving NaCl or glucose, if the child or the person is giving calcium ringer lactate, it is isotonic with the plasma and serum, number one thing. Secondly, each and every health worker and ANM and Anganwadi and Asha, that time there were CHVs. They were trained how to diagnose dehydration and how to give oral feeds. For 2 years continuously, I was training medical officer, DHO, civil surgeons, and everybody. Our visiting card was given to each and every worker where it was mentioned how you can give oral rehydration. And believe in me, within 2 years or maybe 3 years, it reduced from 2% to 0.2% in a span of 0.2%. But I have full satisfaction, but I have not paid anything. But suppose a pediatrician, he gives life by IV fluid, he will be paid tremendously, right?
Yes.
The child suffer by dehydration and all this stress. The parents will pay the physician. Physician will be happy. We have averted so many deaths without even bought into the notice of the parents. Do you agree with me?
Yes.
So it is a thankless job.
Yes.
But those who do it, they have full satisfaction.
Okay. Okay, so thank
And
you.
secondly, it is the government policy.
Okay.
Earlier, there were called as sanipid. In Russia, the scientists who were experts in sanitation and epidemic, they were made in charges of regions and they were highly paid. And if they are paid, if given the opportunity, if given powers, I think people will come. Okay?
Okay, okay. So I would request everyone to switch on their cameras for a group photo. So you can stop sharing your slide.
Okay.
You all please switch on your cameras.
Yeah, thank you all.
Done?
Yes, Purnima. Yes, Purnima. Yeah.
Yeah. Okay, so thank you so much for this interactive
Thank you,
session.
everybody. If you have any comments later on also, you are most welcome, either through mail or WhatsApp. Any your queries, any interaction, I'll be very happy to have interaction with young colleagues like you, right?
Yes. Okay. Thank you so much, sir, for your time and this interactive session and information about how we can further use technology also to build new platforms and bring changes in public health sectors also.
Maybe Purnima, I will contact you a day or two for AI intelligence, artificial intelligence.
Yes, sir, definitely.
The group who is working on that, if you know anybody working on this, we are having some workshop on artificial intelligence in health. So I'll be contacting you.
Yes, sir. Yes, sir. Definitely. Thank you so much, sir.
Thank you. Thank you.
Okay, bye.
Bye.